Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. What you see here is a year's worth of the interest for the term inflammation. Google Trends provides this convenient method of understanding the interest, understanding people's interest of a term. So this goes into first inflammation, as I said, and so the number of individuals that have been looking at this kind of fluctuates but stays pretty steady. So it's all around 75. You can think of it as percent. It's all kind of similar interest. What I want to show you now is that the popularity of the search term, may be indicative of more individuals in that area having inflammation. Now you might be asking, how is area have to do with inflammation? Well, a lot of it has to do with heat and how inflammation may get triggered in certain areas. So certain clusters of neighborhoods have been shown to have more inflammation than other neighborhoods. So you can, with the presumption that inflammation search is also paralleling potential inflammation, Texas, Mississippi, Idaho, Arizona, and West Virginia. These are the top 5 states where inflammation was researched the most. So I would presume that these are all southern states, Southwest, and then West Virginia actually is an outlier because, technically it is very much, and the search interest was 91, which is pretty high. So let's move on to what else you can do with this feature. When you go further, some interesting related topics might provide some information that you may not have known before. So one of the inflammation related impact is in COVID. Not many people know this, but when the COVID-19 infection actually starts to elicit more and more inflammation from the body, this is what had turned and has turned COVID into severe COVID in some people, which eventually causes mortality. And then body fluid is an interesting one, blood vessel, respiratory tract. All of these are many times getting inflamed, even respiratory tract, blood vessels, within the blood vessels when there's inflammation that actually aids in atherosclerotic plaque taking place. So some related queries. Now this gets interesting. Of course, enlargement of the heart, dilated cardiomyopathy, acetaminophen reduces inflammation, but anti-inflammatory foods. Let's expand on this, and then bronchitis is important too. But anti-inflammatory foods are the most interesting. Now, the fluctuation is more interesting rather than the actual interest. If you look at anti-inflammatory foods, it kind of fluctuates, but some of these upticks are interesting. So you have to wonder what makes these upticks. And then there's kind of ups and downs, which are worth exploring. Why there is that? Is it because of diseases that are taking place? And that's why people are looking for anti-inflammatory foods? Or is it just the popularity of the anti-inflammatory foods are being advertised more, maybe? So this is kind of what happens. You can, again, look in additional states to see where they're at. So Indiana, for instance, looked at anti-inflammatory foods. And so this kind of searching, like vitamin C, glycemic index, these are all kind of there to reduce. And then foods that can cause inflammation is another important aspect. And then what foods cause inflammation? So diet-related inflammation is something that a lot of people have worked on, researchers and scholars and non-practitioners as well. So this is all that there is here. Thank you for listening.